Basics of History Taking. Part 3. Menstrual and Obstetric History. Developmental History. Menstruation is a natural body function. Menstruation is a sign that the reproductive system is functioning healthy and well. The onset of puberty, when the girl has her first period, is known as menarche. For women in the menstruating age group, record the age of menarche, duration of each cycle, regular or irregular cycles, approximate volume of blood loss in each menstrual cycle. Good menstrual hygiene is essential. Discussions on menstrual hygiene are important for adolescent girls to clarify existing myths and misconceptions around menstruation. Improving menstrual hygiene is important from the point of view of personal comfort and increased mobility. It also reduces the likelihood of infections resulting from poor hygiene practices during menstruation. For individuals who have attained menopause, record the age of attainment of menopause and history of any postmenopausal bleeding. An obstetric history involves asking questions relevant to a patient's current and previous pregnancies. Some of the questions are highly personal, therefore, good communication skills and a respectful manner are absolutely essential. Note that before 18 weeks gestation, most obstetric conditions are unlikely, therefore, your history should be gynecology focused. The following inquiries are to be made. Gravidity. Number of times the patient conceived. Parity. Number of times pregnancy was carried to term. Number of abortions. If yes, whether spontaneous or therapeutic. Number of living children, their ages, and the age of the last child delivered. The time interval between successive pregnancies or abortions. Mode of delivery. Vaginal, forceps-assisted, or cesarean. Development of edema legs, hypertension or seizures in the antenatal or postnatal period. Presence of impaired glucose tolerance in the course of pregnancy or history of having given birth to a large baby may give a clue to the presence of diabetes mellitus in the patient. Developmental history. An account of how and when a person met developmental milestones, such as walking and talking. Used primarily in the diagnosis of developmental disorders. Developmental milestones are categorized as gross motor, fine motor, speech and language, cognitive or problem solving, social or emotional. Few key developmental milestones. Held head up, feed self with spoon, sat alone, bowel training, initiated versus completed, crawled, walked alone, assist with dressing, spoke first word then sentences. It is also important to note the energy level of the child, muscle coordination and gait. The assessment of speech, language, and hearing includes language spoken at home. Does the child prefer to talk, gesture, or do both? Does the child most frequently use sounds, single words, or 2 to 3 word sentences? Did speech learning ever seem to stop for a period of time? Does the child understand what you say to him or her? Can he or she follow simple commands? Assessment of cognitive, social development includes details of when the child exhibited certain behaviors, like social smile, recognizing parents, developed stranger anxiety, orients to name, develops separation anxiety, follows 2-step commands, understands gender difference, learns how to read, understands directions. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.